What is up, Smash Ninjas? We are hanging out at Delta. Hey, by the way, right there, that's Myra. She runs the show. She owns this place. So come see her. And that crazy son of a bitch over there is Jose, and I think he did like 60 pull-ups in a row. I think they were probably strict. He just does stuff like that. We're gonna be talking about anterior pelvic tilt and low back pain. So that anterior pelvic tilt, remember, first thing, low back pain, it's super bad. But that anterior pelvic tilt is what's gonna contribute to a lot of that low back problem. So if you look at the way the pelvis sits, remember what I said, it sits like a bucket and it dumps forward. By the way, I gotta throw this on here. That guy right there, Matt, okay, he just did 4 muscle ups in a row. First time ever. In a metabolic load. That's pretty savage. In a workout.
Master over here.
He's legit. He's legit. So, yeah, I'll see you, Matt. So he worked out with me this morning. It was pretty awesome. So we were talking about the pelvis, the way the pelvis sits, and I'm going to slide out of the way so I don't get in anyone's way. So if you look at the pelvis, it sits like a bucket. You don't want it to dump forward or backwards because, just like I said, I'm tucking out of the way because they're doing a warm-up here. If it tucks forward, what happens is it shears that lumbar spine, and now I'm kind of yapping a lot, but let me get out of the way here so I'm not kind of blocking anybody off. But it shears the lumbar spine, loads up those lumbar discs, and the problem with that is that when you do things like Oli lifts, you drop into the squat, that extension, that lumbar extension winds up being a butt wink because you overcompensate the other direction. So what happens, I'll show you, is, sorry, I'm a little wad drunk, but the pelvis rocks forward, it throws you into extension, the hamstrings fire, the glutes disengage, the hamstrings take over, the quads take over, you wind up spinning your knees forward on your squat, and you wind up shearing that L5-S1 and just doing all kinds of damage. Never mind the fact that your hip starts to mute, right? Because it's super closed. You can't do that violent hip extension, which is what you need when you do your cleans, all your lifts, never mind any sport that involves cutting back and forth. So what happens is all this stuff gets chewed up. Your knees dump into what's called a valgus position. So you want to see everybody warming up, just look this way. It dumps into this valgus position, so then MCL gets all chewed up, and then your ankle falls into what's called a navicular fault. You see where I'm going with this? It's a huge nightmare. So we're going to show you how to clean all that up and get rid of your low back pain. We're going to hit the rectus femoris because it's this piece of bacon that you sewed into your leg, and I guarantee you, if you don't think it's there, take your thumb and run it across here, and I bet you'll feel like you're going to bring up a boot. We're going to hit that psoas. Remember that iliacus comes off the ilium, and the psoas comes off the lumbar spine, drags you into extension, and then we're going to go over good old classic couch stretch, which you guys probably aren't doing. So we're going to get her done. So what you do, number one, is check this out. This is super legit. You're going to get a box. It's this easy. So I'm using a 35-pound bar. You're gonna get a box. You're gonna pick up the Oli bar. You're gonna chuck it across your lap. You're gonna do this without bringing up a work boot because it hurts. You're gonna find that hot spot. Remember that rectus femoris runs right down the front, crosses over the knee, and hits the tibial tuberosity right on the front, comes all the way off the AIIS. So there's a lot of mechanics involved because it crosses the hip and the knee. You're gonna hook one hand under here, and you're gonna push down on this side, and all you're gonna do is kick in and out, baby. And just smash away, peel that tissue away, work your way all the way down to just above the knee. Stay off that suprapatellar pouch. You don't need to have this much weight on. This is 135 or 125, I guess, because it's a women's bar. All the way down. That's number one. Number two, super wicked easy. You can use a kettlebell. Sorry, I got the wad drunk sniffles. So you're gonna go just to the side of the belly button. So you're going 1 inch lateral to the belly button. You're gonna grab a kettlebell, flip it upside down, tuck the horn of the kettlebell in just lateral to the belly button, both knees bent so you disengage the pelvis. Now remember the knee tracks out. It doesn't track straight up in because you wind up hitting that ledge on the acetabulum. So you just hold it and then just kick in and out. So the kettlebell's right here. I'm gonna move my hand out of the way. Kettlebell's right here. You're gonna do how many? 2 minutes of this nonsense. 2 minutes. That's number two. Undo the psoas. Yeah, do both sides. Number three is gonna be kicking out that couch stretch. And this one's a classic. And you can do this anywhere. I think if you guys follow me, I've done this on an airplane. Now imagine that, airplane seat. You can do this anywhere. Couch stretch is gonna hit the iliacus, the psoas, and that rectus femoris all in one move. So it saves you the trouble of doing a ton of stuff, and it's gonna unload that lumbar spine. Let's see if I can get this to stay. I know I'm failing on my camera duties here today. So just kick up on the wall. So you can see I've got this all the way up against the wall. Shin is essentially perpendicular to the floor. I'm gonna push my pelvis forward. We're not gonna knock over anybody that's warming up. They're not gonna knock me over. That's how it works. Squeeze your glutes, push this forward. Remember, this is not a couch stretch. This is how everybody tends to do it. And it's not okay because you're arching and putting yourself into extension. So suck yourself in, squeeze the glutes, push the pelvis forward. How long do we hang out? 2 minutes. Hook grip Mickey says you gotta stay here. Hey, listen, that's it. That's how you clear out low back pain. That's how you open up your hips. You fix a lot of stuff, get out of that extension, dump that anterior pelvic tilt. I'm Trev, SmashweRx, hanging out at Delta. Have an awesome day.